Hello, and welcome back to Legacy of Leaders, where we interview the brightest and most interesting leaders in the community, and today is no different. I'm your host, Whitney Mincy, joined by very special guest, Mr. Waqas Ahmed, MD, from American Telephysicians. Welcome.
Thank you. Good morning, and thank you so much.
Absolutely. I'm so glad to have you here because I'm always interested in the companies and the industries that are on the cutting edge of technology. So first of all, tell us about American Telephysicians. What do you guys do?
Thank you, Whitney. So American Telephysicians is a physician-led virtual healthcare company. Of course, we utilize technology to deliver healthcare and make it more affordable and accessible.
And so how'd you get into this? Why are you so passionate about it?
So my background, I am a kidney specialist, nephrologist, and hypertension specialist. And the journey started before COVID, and wanted to solve the problem of the healthcare access. Especially, it was my mother healthcare, because living, far from her, and it was pretty, obviously bring emotional memories to me. But I started this company to solve the problem. How can, if you are away from your families and loved one, how can you be involved in their healthcare?
And that's so important. And I think a lot of people can relate to that, being far away from the people that they care deeply about and hoping that they can get good care from someone, even if they're not in the area.
And the other issue, I think, would always is the healthcare cost. I mean, I'm a physician myself, but when you start seeing the bills for the healthcare services and the surprise bills, I think those are two things, like how can we reduce the cost and how can we improve the healthcare access? I think that patient-centric healthcare approach is what kind of motivated me and my other colleagues, co-founders, who joined hands and say we're going to build something with utilize the technology to solve those two big problems.
And so you mentioned COVID earlier, and I have to imagine COVID was a catalyst for what you do and how you do it. So tell me a little bit about that.
Yeah, of course, telemedicine traditionally has been seen as a virtual consultation and online consultation with a physician, and of course that accelerated during the COVID. But as you can imagine, with all this technology, the wearables, and now with artificial intelligence, it's like has gone far, more than just a video consultation. Now we're talking about how can we manage patients at home, how can they be more engaged, how their data is, being tracked, and when I say data being tracked with like healthcare data between the doctors and the patients. I'll give you an example. I do hypertension clinic. I mean, you don't necessarily need to come to my office to see me all the time. If I am able to get all your blood pressure readings while you're at home and taking it, and then you're getting a call back from your nurse, an alert, hey, your blood pressure is running high. These are the things you need to do.
Yes.
This is what exactly, I think that why technology is so fascinating, and it's around the patient care.
So we talked about the past with COVID. What do you envision for the future of healthcare?
It's obviously things are changing pretty fast, but healthcare is regulated, very complex, and it has to be that way. I guess obviously because it's all about the patient's, physician's trust, as well as so what I see is that how the technology is reshaping. It's going to be a lot of innovation, especially with AI. Is going to make a lot of things automated. And this is where I think our company is now very passionate about building those AI into the technology system we have built. We essentially are focused on right now two things. One is we have a whole venture around people who don't have insurance or don't have like self-pay or like 1099 workers. That project is called Cura for You. It's give them healthcare services under one app with all the price transparency and savings. And second is is focused on the patient brain and mental health project named NeuroX.
Yes.
Very passionate about that too, because I've seen my father having some memory issues after having an episode, and this is where I think that a lot of people who don't know if their risk for developing the dementia and memory problems, especially underlying mental health conditions. So we have built those tools to help them early diagnosis, giving them access to the physicians from their home, and then essentially the treatment plan, including remote monitoring. So I think those are two projects which are really keeping us very engaged.
Yeah, I mean, that's incredible, especially the neuro side of things and how technology plays into that. But thank you so much for being here. Unfortunately, we are out of time, but if you want to learn more about American telephysicians, make sure you head over to dailynewsnetwork.com. All of his information will be listed there, and we will see you next time on Legacy of Leaders.